Let's make a start. Thank you for attending today. This session will be recorded and it will be available on the Business Station website in the next few days. So keep an eye out for that if you haven't been able to make today. Also, I will be sending a copy of this presentation to you after the event. You'll probably get that tomorrow. So you'll have the notes from today. And what I'll be doing is just working through. The purpose of today's session is just to look at the NDIS Quality and Safeguarding framework. That's the basis upon which prospective disability service providers will be assessed. Policies, procedures, work instructions that they need to implement to first of all conform to the requirements of the standard. So in the first instance, you need to have the right documentation depending on the types of services that you're going to provide. And then when the auditor comes to do your certification, then they're going to want to see evidence of implementation. So what we're going to go through today is essentially the framework, looking at the types of policies and procedures that you're going to need to develop, and what is involved in terms of the things that an auditor would look for. And obviously, it's obviously not about getting yourself audited. You've got to do that to get yourself certified, but it's ultimately about the quality of service that you're going to provide to the participant, which is the term that they use. You can use the word client or customer or whatever, but the participant is the person that is going to be accessing the NDIS service through yourselves. So that's why they call it quality and safeguarding. You've got to provide a quality service, but you've also got to safeguard the person that you're providing that service to, and that's the whole basis of the framework for this. And there's a range of core modules that you must have, which are generally around organisational type matters, and then there's supplementary modules, which you need to, depending on the types of services you're going to provide, you need to have some documentation and processes around that. So let's make a start. So it is quite a heavy session in terms of what we'll go through, but I think you'll get a lot out of it. So digital solutions, that's the standard service that any business or not-for-profit can provide, they can access. So you are welcome to take advantage of that. But I'll hand over to Jared. He's just going to talk briefly about the new service that Business Station is offering for NDIS service providers. So I'll just hand over to you briefly, Jared.
Yeah, thanks, David. So, hi, everyone. I'm Jared Townsend, a digital advisor with Digital Solutions. So, a bunch of you might already be in this program, so the NDS Digital Solutions Support Program, and there might be some of you that are not. If you're not already, so basically what's happened is NDS has partnered with Digital Solutions, so the federal government program, to deliver this program free of charge, so fully funded, for people working with disability in the disability sector in Queensland. What it looks like, you get 3 mentoring sessions, you get 4 workshops and webinars, plus bonus HR workshops like this one that David's kindly delivering for you guys today, and then access to online learning. So if you are for-profit or not-for-profit, have less than 20 employees, operate and have an ABN in Queensland, then you're eligible. And you can see the link on the screen and the QR code. If you're not already in the program, feel free to jump on there, answer a couple of questions and get registered. And then we can start stepping you through the Digital Solutions program as part of that NDS Digital Support. So just to clarify, it's a federal government program, and NDS has decided that they want to support anybody in the disability sector across Queensland at this point as a bit of a trial, and they've basically paid the extra cost associated to allow you to operate in this program for free. And back over to you, David.
Thanks, Jared. So yeah, certainly take advantage of that program and any other services that Business Station offer you as well. So just go to their website and you'll have all the details there. So this is just a bit about me. I'm a business manager. I do provide a range of business support services, policies, procedures, management services, and the like. I do work in the disability space. I'm not a practitioner in the sense that I'm, an occupational therapist or a medical person. I'm a business manager, but I have worked with disability service providers to develop and assist them to implement their quality and safeguarding framework. I've also provided, in conjunction with a couple of other consultants that I engage, to work with organisations on improving their HR policies and procedures to remove barriers to people with disability from applying for work and working with that organisation. I've written disability access and inclusion plans and worked in small business to look at preparing accessibility guides to help small business become more accessible to people with disability. So I bring sort of a business management perspective to this program, and that's what we're going to be talking today. And I've been a Business Station advisor in Perth in Western Australia since 2014. I was one of their first external advisors that they engaged. So let's make a start then. So the NDIS practice standards, it's about quality management, the quality of service that you're going to provide to your client or the participant. So you need to demonstrate the quality aspect of it. But you also, from your point of view, that provision of quality service, but you also need to make your client, if we call them that, aware of what quality service provision they should expect from yourself. So it's about quality service, communication, and the like in terms of providing that quality service to your customer. And you need to read the standards in conjunction with the NDIS Code of Conduct. There's certain legislation that you need to comply with. You need to read that, and that's all available on the NDIS website. So the practice standards, it consists of a number of modules. The first one is the core module. These are things that you must have and you must demonstrate, and they're across all service providers. And then there's supplementary modules, which apply depending on the types of supports and services you intend to deliver to your customers or your clients. So that's what we'll go through. So not all the supplementary models are going to apply to you, but certainly the core modules will. And each module has, they're based on outcomes. So you're going to be measured on your ability to deliver those outcomes to a client. And then the quality indicator, which is what the auditor will look for when seeking to, or when assessing your capacity to be able to deliver that and register your organisation as a service provider. So the core modules, there's for the ones that are you must deliver. As I said, they're core, so every organisation has to provide this. So rights of participants, governance and operational management, delivery mechanisms for support, and the environment in which the supports are delivered. So they're the core modules that are important elements, and we'll go through each of those in this presentation. The supplementary models, high intensity daily support for personal activities, specialist behaviour support, childhood support coordination, disability accommodation. They're the ones that, as I say, you may or may not be providing all those services, but you will be, the ones that you do, you will be assessed against. But as I said, the core modules are the ones that you must meet. So we're going to go through each of those. So the first one is around rights and responsibilities. So these sets out the rights of participants and the responsibilities of service providers. So as a participant, they have a right to receive a range of things. So the first one is person-centered support. So what this is saying is each participant accesses support that promote, uphold and respect their legal and human rights and is enabled to exercise informed choice and control. So you need to respect their rights as an individual. Just because they have a disability, they still have certain rights to make decisions on their behalf and to be provided with information to make them make informed decisions. So these need to be incorporated into everyday practice. You need to be responsive to the needs of the individual and provide information in language accessible to them in a language or mode of communication in terms that they are most likely to understand. So the information that you provide needs to be in an accessible form, and you also have to engage with their family, friends and chosen community in which they live. So individual values and beliefs. So you need to respect their cultural diversity. Not everyone's going to be Anglo-Saxon, so you need to speak and engage with their particular culture and understand that and respect their culture, diversity, values and beliefs, and also create the environment in which they can practice their culture, value and beliefs as well. So privacy and dignity goes without saying. You need to respect their privacy and their right to dignity as well. So, personal privacy, confidentiality policies you need to establish, and personal information. So basically a privacy policy outlining how you collect information, why, how you store it, use it, dispose of it, how they can access that information. So independent and informed choice. Each participant is supported by the provider to make informed choices, exercise control and maximise their independence relating to the supports provided. So you've got to encourage an environment in which there is active decision-making and individual choice, provide information to assist them to do that. They also have a right to the dignity of risk in decision-making. So you can't take, everyone has a right to make certain decisions as to what sort of things they want to participate in, what sort of things they want to do. There might be an element of risk at that, and you have to respect their right to do things that are a bit risky as well, like all of us. So you need to respect that as well. Intimacy, and consider the review their options and seek advice if required. So you need to constantly communicate with them and get an understanding as to what they want to achieve, and then put in the framework to allow them to do that. The other thing that they also have a right to is an advocate. So there are advocacy services that people with disability can access. They might be having issues with you as a provider. They might be having issues with the NDIS service or any other agency. They have a right to access an advocate to assist them to work through those concerns that they may have, and you need to provide that information to them. So the supports need to be provided free of violence, abuse, neglect, exploitation and discrimination. So that goes without saying, we all have that right. So you need to put in place mechanisms within your organisation to actively prevent that from occurring to the client. You need to provide information about the use of an advocate, as we talked about, and access to an advocate is facilitated where allegations of violence, abuse, etc. are made. So if you come across that, and it's not violence and abuse that you're committing, you might become aware of it within their environment. You need to assist them with access to advocacy services and the like. And if you come across any allegations of that, you need to act upon that, provide support and assistance where necessary, and you also need to keep records of any details and outcomes of reviews and investigations that you may undertake. So that's the requirements around ensuring the rights and responsibilities of participants. The next module is around governance and operational management. So this is looking at your organisation and how you're going to manage that. So that's what we're going to talk. So this is the operational management side of it. How do you run your organisation? That's what this section is about here. So you need to establish a range of policies and procedures around governance and operational control. So each participant's sport is overseen by robust governance and operational management. So this is basically ISO 9001 quality management, the processes that you go through to deliver a quality service to your client and comply with the requirements of the NDIS framework. So you need to provide opportunities for them to contribute to the governance, or contribute to how you're going to provide that service with them. You need to have a defined organisational structure and that allows you to meet financial, legislative, regulatory and contractual responsibilities, and monitor the performance of your implementation of the safeguarding framework. You need to make sure that your organisation and the people that you engage have the skills and knowledge required to deliver the service and provide training as required, and that you have strategic and business plans in place to run your organisation. Continuous improvement. So you've always got to continually improve how you run your business. You've got to engage suitably qualified or experienced employees. You've got to document the delegated responsibility and authority. So if you're delegating certain roles or decision-making to certain people within your organisation, you need to have that documented. And you need to have policies and procedures in place around managing conflict of interest as well. So the other one is risk management. So you need to establish a risk management plan and register of risks, identify your risks and put in place treatment plans for those. You need to document that, and things that you might want to look at: incident management, complaints management, work health and safety, and human resource management, financial management, information management, which is your IT security system, and your governance framework. So they're the things that you need to look at in the context of risk. Put together a risk management plan and treatment plans for them. And then you've got quality management. So ISO 9001, what are the processes you're going to go through from the time you engage a client and the types of services and how you deliver those services. So each participant benefits from a quality management system relevant and proportionate to the size and scale of the provider, which promotes continuous improvement and support delivery. So, the extent of your policies and procedures and the level of rigor and involvement in the development, that obviously depends on the size of your organisation, and that's an important element. That you don't necessarily need voluminous documents, but you need some procedures that are relevant to your business and that you can implement. So, quality management, as I said, ability to meet your legislative and other compliance obligations, looking at internal audits to make sure that you're fulfilling the requirements of the standard and other of the quality of the NDIS standards and other requirements, and that you've got a process in there for continuous improvement. Information security management. So this is your record keeping and privacy. You need to respect the privacy of your clients. So you need to have policies and procedures around how you manage your information, how you protect it, how you store it, and the like. So you need to obtain consent to collect information. You need to inform your participants on how their information is stored and used. You need to have in place systems to maintain the security of that, and documents are stored with appropriate use, access, transfer, storage, security, retrieval, retention, destruction, and disposal. So you are allowed to dispose of records, but there's a proper process that you need to go through, and you need to develop some procedures around that. And generally, the NDIS framework will outline and also the tax office and those, depending on the type of records, will give you advice on to how long you need to keep them. You also need to, and as part of the quality framework, is this feedback and complaint. So you need to have mechanisms to obtain feedback from participants and others. It could be their family or other people. So there's general organisational feedback, but there's also feedback coming from participants. So, and you need to provide access to that feedback system to your participants, and you should welcome that feedback as an opportunity for continuous improvement as well. So you've got to maintain a complaints management and resolution system. The National Disability Insurance Scheme Complaints Management and Resolution Rules 2018 is something that you should refer to in developing that. There's also an Australian standard 0002 on complaints handling that you may want to use as a basis. So each participant is provided with information on how to give feedback. You need to demonstrate continuous improvement. So once you've received that feedback, there needs to be a process in place as to how you handle that. And remember, feedback can be both positive and negative as well. So you should be encouraging feedback and looking for opportunities to improve your business and your service offering through that feedback. Then you've got to have some other requirements around the core modules. So information we've talked about, feedback and complaints. Incident management is the other one. So what happens if an incident or an accident happens to your client? The National Disability Insurance Scheme Incident Management and Reportable Incidents Rules 2018 apply here. You need to have policies and procedures around how you're going to manage incidents and report them. They may need to be reported to the NDIS governing body. So you need to be mindful of what those incidents are. Each participant is provided with information on incident management, including how incidents involving the participant will be managed. So you need to communicate that to your client, and you need to put in place continuous improvement in incident management by regular review of incidences, the policies and procedures, review of why incidents happened, how you manage them, and what you can do to, the preventative action that you put in place. So other ones are human resource management. So how you engage your workers, your recruitment, selection, induction, performance management. You need to have in place policies around that, pre-employment checks, qualifications and experience. So there are, you need to, like any employee, you need to go through that process. Do they have a right to work in Australia? Do they have the right qualifications that you need? Do they have a police clearance if you require that? First aid certificate, registrations and licenses to undertake that job role. So they're the things you need to look at. So induction processes, performance management, supervision, and the like. So stock standard HR policies and procedures, but geared towards providing that service. So some of your employees are obviously going to be administration based, others are going to be direct providers of service to your clients. So continuity of support. So someone's a client is assigned a particular support worker. That support worker leaves your employment. You need to ensure the continuity of the support to that client. So, look at succession plans, business continuity plans, those types of things you need to have in place, arrangements to ensure support is provided to the participant without interruption. So the other one, the other module is provision of participant support. So this is dealing with access to support. So each participant access the most appropriate supports that meet their needs, goals and preferences. So generally when a new client is engaged, you'd sit there and put together a support plan that outlines what they're wanting to achieve from engaging your services. So supports are available, reasonable adjustments are made to their environment, and they're given an opportunity to understand what circumstances supports can be withdrawn. So the support planning process, you need to sit down with that client and their advocate or family and put together a support plan. So, develop the support plan, look at risk assessment processes, periodic reviews of their plan, look at, what mechanisms to change their support plan, progress in meeting the outcomes, and the like. So the support plan is essentially how you're going to go about putting in place the services that they want. And that's generally documented in a service agreement, so a legal document between yourself and the participant and their family or advocate, with support of their family and advocate. Each participant has a clear understanding of the supports they have chosen and how they will be provided. So you've got to collaborate with them on that, and put that in a document, a service agreement that clearly outlines the rights and responsibilities of both parties and all the mechanisms to change that and implement that. So responsive support provision. So each participant accesses responsive, timely, competent and appropriate supports to meet their needs and desired outcomes. So look at least intrusive options, developed through collaboration involving the participant, and that your workers are appropriately trained and understand the participants' needs and preferences. There might be a case where a participant or your client wishes to transfer to another service provider, or alternatively someone wishes to transfer to yourself. So you need to make sure that you've got procedures in place to ensure that each participant experiences a planned and coordinated transition to or from the provider yourself. So so if they do want to move to another provider, you need to facilitate that, and likewise facilitate someone coming from another provider to your organisation. So do so in collaboration with the participant, look at the risks, and then develop the processes to facilitate that. So, and the final core module is around the support environment. So these sets out the environment in which supports are to be provided to a participant. So the first one is safe environment. So everyone, your client needs to access their supports in a safe environment that is appropriate to their need. So each participant can easily identify the worker or the support worker that they're going to have. So your support worker should have some identification to say who they are and who they work for. If the support is provided in the client's home, work is undertaken with the participant to ensure a safe environment for the delivery of those supports. And where work is undertaken with other providers and services to identify, treat risks, ensure safe environments, and prevent and manage injuries. So the other one is managing participant money and property. You need to do that in a secure manner, and the participants use their own money and property as they determine. So they have a right to use their own money. You need to facilitate that. But their money is managed, protected and accounted for, developed, applied and reviewed and communicated. So this might be the case also where you have access to their money, then you need to document procedures as to the prudent and appropriate use of that money and property. And you need to support their right to spend their money as well. You're not to give financial advice or information though. So it's not for you to advise them on how they're to use their money. They have a right to use their money however they want. You need to create the framework to allow that to happen. So management of medication, again, you need to, the framework is all around making sure that you've got the policies and the procedures and the right people in place to be able to deliver all this. So you need each participant requiring medication is confident that their provider administers, stores and monitors the effect of their medication and works to prevent errors or incidences. So you need to have documentation around what medication that person will have, how it's to be administered and how it's to be stored safely and securely. So the other one is waste management. The management of exposure to waste, infectious or hazardous substances. So this is more the case where you might be providing services from somebody's home. So you need to have some procedures around the disposal of waste, infectious or hazardous substance. Any incidents have to be reported, recorded and investigated. So that's your incident management procedure. Emergency plans are in place where people are exposed to any clinical waste or hazardous substances. And if you have workers that are involved in the management of waste and hazardous substance, that they have received the appropriate training and they ensure a safe and appropriate handling of that. So they're the core modules that you have to comply with. So you need to develop policies and procedures around each of those core modules and put in place the right people, the right organisational structure, the right administrative support to allow those core modules to be delivered to your client. The next ones that we're going to touch on are supplementary modules. They are dependent upon obviously the size of your organisation, but what actual services you're going to actually provide. The first one I'm going to touch on is the verification module, and this applies to NDIS providers who are delivering lower risk, low complexity supports and services. So this is a bit like, I guess, a smaller organisation that is only providing particular services. You're not one of the big, disability service providers that may provide everything. You may only be providing targeted services to particular individuals, but you still need to have a framework around that, and the verification module is the one that would be most applicable. But again, it is similar to the core requirements around human resource management, so how you engage, the whole recruitment, selection, induction, performance management process. You need to have provisions around incident management, complaints management and feedback, and risk management. So similar to the core modules, you've got to put in place a framework, and it's all based on the the size of your organisation. It's got to be proportionate to that. So if it's yourself and a couple of other people providing a small range of services, then this is the module that you would look at in particular. But again, I would also look at the core modules as a good base, and then the supplementary models would relate to the particular services that you're going to provide. So we'll go through those. The first one is high intensity daily personal activities. So this is where there is a lot of medical aspect to it. As I said, I'm not medically trained, but where you're providing a certain level of, I guess, medical component, you need to employ the right people to do this, and they're the sort of services that come with it. And again, it's about having the procedures in place that your worker can refer to and how to manage these things. Also, the support plan that is provided that's developed between yourself and the client will outline the requirements around these things, and also the NDIS framework and any other medical requirements that have been given them to by their doctor as well. So bowel care, feeding, and the like, they're the ones that you need to have procedures in place and the right people to be able to administer those requirements. So specialist behaviour support model. So this is specialist behaviour in particular. So looking at the client, what sort of complex needs and support that they have. So behaviour support, each participant accesses behaviour support that is appropriate to their needs, which incorporates evidence-informed practice and complies with relevant legislation and policy framework. So the National Disability Insurance Scheme restrictive practices and support behaviour rules are the ones that you need to apply here. So all behaviour support practitioners have been assessed as suitable to deliver the services. So again, this is your recruitment and selection process. They undertake ongoing professional development to remain current in their ability to provide these services. The supervisors have suitable skills and experience, and you must look at demonstrated commitment to reducing and eliminating restrictive practices. So restrictive practices is another one. So these are things that you put in place to restrict the movement behaviour of participants. And this is something that is becoming less appropriate. And there is the documents that you need to refer to are the Disability Insurance Scheme, Restrictive Practices and Behaviour Support Rules 2018. In addition to knowledge and understanding of any relevant state or territory legislation or policy in relation to restrictive practices. So the outcome that is being looked at is each participant is only subject to a restrictive practice that meets any state and territory authorisation requirements and the relevant requirements and safeguards any legislation. So you can't apply your own restrictive practices. You've got to make sure you basically comply with the law on these sort of things. So you've got to include any restricted practices in the individual support plan. They've got to be proportionate to the risk of harm to the participant or others. But your aim should be to lead to the reduction and elimination of any restrictive practices that are included. So this is last resort, not first resort. So you need to try and eliminate these things altogether. So the other one is functional behaviour. So again, within the support plans, Each participant's quality of life is maintained and improved by tailored evidence-informed behaviour support plans that are responsive to their needs. So the key word in a lot of the development of the support plans is collaboration with the participant and their client and their family and other people involved. Support plans are regulated and need to be provided to the NDIS Commissioner, where restrictive behaviours are included in that. So the implementation of the support plan, each participant's behaviour support plan is implemented effectively to meet the participant's behaviour support needs. So you need to obtain authorisation to use restrictive practices. Instructions and guidance are developed to support the participants. So again, your policies and procedures. It's person-focused training, coaching and mentoring is facilitated delivered to each provider implementing behaviour support plans. So you need to have a good training regime in place for your workers to ensure that they're delivering the latest requirements in that regard. And again, and the other area is in relation to behaviour support plan monitoring and review. Sorry, back here, the second dot point down. So you need to, once you've established the behaviour support plans, these need to be evaluated through each stage of the client service and modified where required. So yeah, constant review and monitoring of the support plan to make sure it's meeting the objectives outlined, agreed to between yourself and the client. Reportable incidences involving use of restrictive actions. Each participant that is subject to an emergency or unauthorised use of restrictive practice has the use of that practice reported and reviewed. So if that occurs, you need to report that to the relevant authority, also internally, and then that can be reviewed to see whether it was done correctly and in accordance with the law. So interim behaviour support plan. So there might be some gap between when you engage that person, when that client is engaged, and you know, when you get the full support plan up in place. So you may be interim plans developed just to start things off. You need to evaluate the risks posed to the services and document that, and advice and guidance is given to providers implementing behaviour support plans. So again, you need to communicate that to your employees. So implementing behaviour support plans. So this applies to those who are registered to provide specialist supports and those using restrictive practices in the delivery. So things that are covered off here: behaviour support, regulated restrictive practices, supporting the assessment and development of behaviour support plans, implementation, support, behaviour support plan review, reportable incidents, interim behaviour support plan. So that's the section that we've just gone through as well. So that's in terms of the implementation of those support plans. So again, policies, procedures, employing the right people, constant monitoring review, documentation review, feedback, and the like. So you need to, so it all comes down to management processes and procedures, the people you employ, good documentation, I can't stress that, clear, concise procedures, support plans that are clearly articulated in terms of what support you're going to provide and the basis for that support, incident management, record keeping and document control, supervision. They're all the key aspects of implementing support plans. So now we're going to look at the other remaining aspects of the modules which may or may not apply to yourself. Early childhood. So if you're providing services to early childhood, and for the purpose of the NDIS, it's anyone under the age of 18. And you might want to split that up into, when you're developing your procedures, age ranges. So obviously someone between the age of 0 and 5 is going to require different supports to someone that's between the age of 12 and 17. So you might want to develop particular policies and procedures based on that age range, depending on who you're going to engage. So with early childhood supports, obviously the involvement of parents or legal guardian becomes important here. So in relation to the child, you need to respect their legal and human rights, support their development of functional skills, and enable them to participate meaningfully and be included in everyday activities. So to achieve this, the auditor is going to look for the following indicators: knowledge and understanding of each participant's legal and human rights, implementation of practices and procedures to manage risk, compliance with all relevant state legislation, and facilitation of active involvement of the participant support network. So participant support network, family, legal guardian, anyone else that is legally entitled to have input into the child's welfare in this regard. So in relation to the family, each family receives family-centered supports that are culturally inclusive, responsive, and focus on their strength. And this term culturally inclusive and is an important element because you're going to be providing services to a whole range of cultures. So you need to be mindful of that in the development of your framework and your approach to providing services. So each support plan is based on child and family choice and control. The family's expertise and knowledge about the child is recognised and respected. The family's strengths, needs and priorities are identified. Each support plan is flexible and individualised. Each support plan is culturally responsive and respectful of the family's cultural beliefs and their community. So it's the broader community too that, the participation of that child within their broader community is an important element of that as well, in addition to adults that you may be providing support to. Information and supports are provided in a clear, easy to understand and flexible manner. The strengths of the family are promoted and developed as part of the plan, and work is undertaken with the family to inform and strengthen their participation in the child's learning and development. So inclusion, each participant accesses supports that engage their natural environments and enable inclusive and meaningful participation in their family and community life. So you need to focus on the child's functions in their everyday routines and activities. All child's inclusive, meaningful and active participation in their family life, community life and natural environment is promoted. Links with each family's community and other support agencies are enabled, and each child's inclusion through participation in daily routines in their natural environment. So you need to, this is basically saying that you need to look at the environment in which the child lives and encourage the engagement or the provision of their services within that environment. The other area that's covered off too is collaboration. So, the development of the support plans and the provision of the services need to be put together in collaboration with the family, the provider, and any other relevant providers and people that have some involvement with the child. So if the family wants to engage a particular worker that you need to assist them to do that. Collaboration with the families we talked about. You need to obtain the consent of the family for any activities, and that you need to provide them with information, knowledge and skills to help the family make informed decisions. And then when transitioning or exiting from your services, you need to put in place procedures around that transition, which is similar to what we talked about earlier on. So the other thing is capacity building. So each participant receives supports that build the knowledge, skills and abilities of the family and the collaborating providers in support to the collaborating providers in order to support the child's learning and development. So the child's, so the support network in each child's life to build their capacity. So you need to engage with their broader support network. Each family is confident in their abilities to be able to assist in that regard. The capacity of the child, family, and collaborating providers involved with the child is built through coaching, capacity building supports, and collaborative teamwork. Collaboration is undertaken to affirm, challenge, and support the child, and feedback and learnings from the child, family, and other professionals is used to improve support delivery. So capacity building is all around making sure the child and their family and other supports have the resources and the knowledge and experience to be able to enhance the child's life, really. So there's an element of education and training that you need to provide to the family as well. And you need to have evidence-informed support. So, undertaking your research on what's available out there. So intervention strategies are based on explicit principles, validated practices, and available research and relevant laws and regulations. Appropriate information, knowledge, skills, and expertise are in place to deliver the quality supports to the family, and knowledge and skills are maintained through continuing professional development. So that comes down to the level of training and support that you provide to your worker to be able to assist them to deliver those services to the client. And the final one is then outcome-based approach. So the whole basis of the support is delivering particular outcomes agreed between yourself and the client, and everything that you do need to progress to achieving that outcome, essentially, which is that one there. So collaboration, capacity building, evidence of informed practices, and outcome-based approach. So the final supplementary model the last one, is there's two more modules. The second last one is a specialist support coordination module. So this applies to providers who are registered to provide specialised support coordination. So each participant receiving specialised support receives tailored support to implement, monitor and review their support plans. So again, you've got to develop the support plan, and then you've got to assist the client to understand that, implement it, monitor it and review it. So demonstrated knowledge and understanding of the risks factors experienced by each participant. Participants are involved in the evaluation of their situation. Consultation is undertaken with the participants and, with their consent, other parties in planning and coordinating supports. Preferences, circumstances, suitable NDIS providers and mainstream service providers that have appropriate skills and experience to deliver the required supports need to be engaged. And there is proactive engagement with the participant in understanding the risks and complexities of any situation that arises through that support, and be mindful also of the monitoring and reporting obligations associated with the participant's plan. you need to effectively manage those. So again, supervision, internal controls and the like. So management of a participant support. So each participant exercises meaningful choice and control over their supports and maximises the value for money they receive from their support. So again, it's again outcome based and value for money. So looking at the indicators here, supports and services arranged using participants' NDIS amounts as directed by the participant and for the purposes intended by the participant. Each participant has been provided with information about their support options using language, motor communication and terms that the participant is most likely to understand. As appropriate, each participant is supported to build their capacity to coordinate, self-direct and manage their supports. And the supports funded under a participant's plans are used effectively and efficiently. So yeah, value for money is a key element. You know, the participant is paying for the services through NDIS, and there needs to be an element of you know, value for money in that, in the services that you deliver. So conflict of interest is a consideration here, and this would also form part of your governance arrangements that we talked about earlier. So each participant receives transparent, factual advice about their support options which promote choice and control. So you need to develop some policies around conflicts of interest between yourself and the participant. You need to communicate that to the client. Your worker needs to be across that and understand where a conflict of interest may arise, and they need to report that. And you need to have in place requirements around how you're going to manage those conflicts of interest. So that would again form part of your governance provision there. So the final module that we look at is if you're providing specialist disability accommodation, applies to providers who are registered to provide specialist accommodation services. So here we look at rights and responsibilities of the participant. Each participant access to specialist disability accommodation dwellings is consistent with their legal and human rights, and they are supported to exercise informed choices in this regard. So you need to make sure that the client is across their legal and human rights, provide information about that. Any agreements or contracts into have been clearly explained to the client before they enter into that. And each participant's autonomy is respected within that whilst living in that accommodation. Again, the conflict of interest provisions apply here. So as we talked about, developing policies and procedures out as to how conflicts of interest need to be reported and managed. You need to enter into a service agreement with the client around the accommodation that's covered by the National Disability Insurance Scheme, Specialist Disability Accommodation Conditions Rules 2018. So things like rent, the bond that needs to be paid, any other payments that might need to be paid, use of equipment and provision of equipment within the property. I guess anything along the lines of entering into a tenancy agreement with say a private rental. The same sort of provisions apply. Some form of tenancy agreement or agreement with the participant on the rights and responsibilities and what they can and can't do within the premises. So enrolment of SDA properties, each participant's specialist disability accommodation dwelling meets the requirements of the design type, category, and other standards that were identified through the dwelling enrolment process. So, when you're seeking approval to provide services, accommodation services, then the premises need to meet the requirements of the NDIS framework in terms of design, category and density restrictions and those sorts of things, how many people can live in the property and the like. So you need to be across that. And then there is the final one is the tenancy management. Each participant accessing a specialist disability accommodation dwelling is able to exercise choice and control and is supported by effective tenancy management. So basically how you're going to manage the property and how you're going to manage the client within that property. So you've got to adhere to the specialist disability accommodation condition rules, policies and procedures that are in place about how the provider will declare, advertise and fill vacancies. You need to, how you're going to work with other providers, how potential conflicts of interest are going to be managed, policies and procedures around violence and abuse, concerns about the accommodation, how a client can communicate those concerns to yourselves as the provider, how behaviours of concern will be managed, how changes to the participants' circumstances or supports will be agreed, communicated, arrangements for continuity of supports, how vacancies will be filled, including the participants' right to have their needs, wishes, choices and situations taken into account. And so again, rigorous policies and procedures around how you're going to manage the premises. You might have multiple people in the one premise, how you're going to manage disputes between tenants, any records of incidences of violence or the like, how you're going to manage that. Issues around insurance of clients' property, incident management and the like. So there you go. So that's essentially the presentation. There's a lot that I've gone through. It is quite a detailed area. I have covered off the whole NDIS practice standards and quality indicators. So it's very, very detailed information there. I will send you a copy of this presentation. If you have any follow-up questions, let me know. I think you should be able to ask away now. There's my contact details if you want to follow up discussion on development of the policies and procedures. You should get specialist advice from those in the medical and provide specialist disability services. I'm not that type of person, but if you need advice on how to structure your policies and procedures, happy to have that discussion with you. So I'll just leave the session going until 10 past 10. If you've got any questions, otherwise I'll close it off. Thank you for your attendance. As I said, the video recording will be available by the end of the week, and I will send you a copy of this in the next day or so. So there we go. Thank you for attending. Now, if you've got any questions, fire away.